Welcome back. Let's continue. The cardiac cycle also creates heart songs. The closure of the AV valves causes the first heart song. The second heart song is generated when the semilunar valves close. These two heart songs are called classical heart songs, and they are audible by using a stethoscope. First heart song may be split because the mitral valve closes slightly before the tricuspid valve. Pathological splitting of the first heart song occurs in stenosis of AV valves and atrial septal defect. The first heart song becomes soft in low blood pressure, severe heart failure, myocardial infarction, and myxedema. A loud first heart song is found in conditions like mitral stenosis and acute rheumatic fever. A loud second heart song suggests increased pressure in the lungs, called pulmonary hypertension. Inspiration delays closure of the pulmonic valve and causes splitting of the second heart song. That is, during inspiration, the pulmonic valve closes distinctly after the aortic valve. In conditions like pulmonary stenosis, right bundle branch block, and right ventricular hypertrophy, the splitting of the second heart song can be heard. The third heart song is a mild song. It can be audible in children but is not heard in healthy adults. It is produced by the rapid flow of blood from the atria to the ventricles. The presence of the third heart song in middle-aged or older adults indicates volume overload, as in congestive heart failure or advanced mitral or tricuspid regurgitation. Filling of the ventricle by atrial contraction causes the fourth heart song. This is produced during atrial systole, and therefore it is also called atrial gallop or presystolic gallop. The fourth heart song can be heard in healthy adults. The fourth heart song becomes audible only in pathological conditions like ventricular hypertrophy, prolonged hypertension, and aortic stenosis. Study of heart songs has important diagnostic value in clinical practice because alteration in the heart songs indicates cardiac diseases involving valves of the heart. Abnormal noises in the heart, known as cardiac murmurs, can sometimes be heard along with normal heart songs by using a stethoscope. Heart murmurs are divided into systolic murmurs and diastolic murmurs according to the time when the murmurs can be heard. Systolic murmur may occur in conditions like AV valve incompetence, semilunar valve stenosis, septal defect, or severe anemia. Diastolic murmur can be heard in conditions like AV valve stenosis and semilunar valve incompetence. Most often, murmurs indicate valve problems. Valvular incompetence produces backflow of the blood. The regurgitation of blood through the valve creates a turbulent flow, which forms the audible murmur. For example, in aortic regurgitation, no abnormal sound is heard during systole. But during diastole, blood flows backward from the aorta into the left ventricle, causing a diastolic murmur. In patients with mitral regurgitation, blood flows backward through the mitral valve into the left atrium during systole. This backward flow also causes a systolic murmur. Valvular stenosis means the valves fail to open completely. The narrow opening restricts blood flow through the valve, and again, the turbulence creates an audible murmur. In patients with mitral stenosis, blood passes with difficulty through the stenosed mitral valve from the left atrium into the left ventricle. The diastolic murmur is produced. In aortic stenosis, the aortic valve cannot open completely. A high-pitched systolic murmur can be heard when blood rushes through the narrow opening of the aortic valve. In condition, the obstruction to left ventricular outflow causes stroke volume and ejection fraction to decline, resulting in decreased cardiac output. Hence, shortness of breath, chest pain, or even fainting may develop. This is the story of Mr. Lin. In summary, cardiac cycle is the alternating relaxation and contraction of the heart. It consists of diastole, a period of relaxation, and systole, or contraction. During diastole, the ventricles relax and fill with blood. During systole, ventricles contract to pump out blood. The closure of heart valves produces heart songs. Improper closing and opening of a valve results in the heart murmur. That's all for today. Next time, we'll talk about regulation of the cardiac function. Thank you. See you next time.